Hello, my name is Zade Gray and I'm going to be performing my heart lab exam. So the first thing that I want my patient to do is lie in a supine position, slightly elevated to about 30 degrees. I also want their gown to be open anteriorly and I want will be on the right side of my patient. So the first thing that we're going to check for is their blood pressure. So I want their arm to be slightly elevated up to about the heart level, and then I also want to make sure that the cuff is going to be placed correctly onto their arm. So some indicators to see if that is placed correctly is that the artery marker is above the brachial artery. I also want to make sure that the cuff is about 2.5 centimeters above the cubital fossa, and then I also want to make sure the cuff is snug enough, but not too tight, still allowing two fingers to be able to go underneath the cuff as well too. The next thing I'm going to check for is I want to palpate for the targeted systolic pressure, and that can be found by the radial pulse down here. Then I'll take my stethoscope and place it over the brachial artery, which is found medial to the biceps tendon, and I'll pump it all the way up to the targeted systolic pressure, adding possibly 30 millimeters of mercury per second, and then slowly deflating the cuff around 3 millimeters of mercury per second. Then being able to report my systolic and diastolic blood pressure in even numbers, adding or subtracting around 5 millimeters of mercury per second to that as well too. After I have finished my blood pressure exam, I want to locate my brachial artery, and I can do that by asking the patient to flex their arm to locate the biceps tendon. And the brachial artery is medial to the biceps tendon. I'll hold that down for 3 to 5 seconds, and then I will locate my radial pulse. Just to confirm, this is the brachial pulse I'm looking for, and then this is the radial pulse. I'm going to hold that down for 3 to 5 seconds. After that, I'm going to do the upper extremity exam. So I want to look at the color, make sure it's all good of the skin. I want to look at the temperature, make sure that's fine. I'm looking for edema, any hotness or swelling that I may find. After that, I'm going to go into digital clubbing test. And digital clubbing is basically bulbous swelling of the nail bed, or an increase in the normal angle of the nail and the nail fold. So I'll be just looking at the nails to make sure there's no digital clubbing. I also would like to look at skin turgor. If skin turgor is decreased, then that can be an indication of dehydration or the normal aging process. So I'll be checking for that as well too. Basically the skin turgor. And then the capillary refill test, where I'll be pressing on one of the nail beds for 5 seconds. And if it's normal, it should go back to its normal state or look within 2 seconds of that. Moving down onto the lower extremity, I'm going to be looking for 2 pulses, which is going to be the posterior tibial pulse, which is located in the posterior to the medial malleolus. I'll hold that for 3 to 5 seconds. And then the second pulse is going to be the dorsalis pedis pulse, which is going to be located in the first and second extensor tendons, and I'll hold that for 3 to 5 seconds as well. The next thing on the lower extremity is I'm going to be looking for color, making sure the skin is all good, temperature, and then also if there's any noticeable hair loss on the skin as well too. Will look for pitting edema, so yes, swelling, but in regards to pitting edema, there's 3 areas that we normally look for. So the first one is the shin, and then we're going to look at posterior to the medial malleolus, and then the dorsum of the foot. If there's indication of pitting edema, where there's a pit or indentation, that could be a sign of heart failure. The last thing I'm going to check in the lower extremity will be the capillary refill test, as we did in the upper extremity. So I'm going to hold down on the nail bed for 3 to 5 seconds, and if it's normal, it should go back within 2 seconds. The next thing I'm going to check is the inspection of the chest. So I'm going to use tangential lighting to do so, and we're going to look for the jugular venous pulsation. And we can find that by first locating the internal jugular vein, which is located lateral and deep to the sternal insertion of the SCM. Something to also know about the JVP is that it is indicative, or it identifies venous pressure, and then also the normal height of the JVP from the sternal angle of Louis is around 3 centimeters as well too. If there's any pathology with the GVP, that can be an indication of heart failure as well. The next places that we're going to inspect is the apical impulse, which we can see within the 5th intercostal space at the midclavicular line. This is also identified as the left lateral border of the heart and the mitral area. And sometimes we may ask the patient to go over onto the left side, and we can just go ahead and check We also want to look at the precordium space to see if there's any other normal pulsations or just in general. And if there is, that's usually a sign of pathology, and that can indicate an enlarged atrium or ventricle. So we want to be, or atria, sorry, and we want to just be mindful of that as well too. Moving on, we're going to start with our palpation. And the first thing that we want to palpate is the carotid artery. So in order to palpate that, we want to find the cricoid cartilage, which is right before the cricoid ligament, and we're going to palpate that for 3 to 5 seconds, very gently. Something to also note is that the normal blood pressure is between 60 and 100 beats per minute. So we will take note of that. Any pathology related to that could be indication of heart failure. The next place that we're going to palpate will be the apical impulse, and this is going to be the mitral area. We're going to use our full hand, but then we're just going to use one finger to identify it. Something to note is that if the impulse is found more lateral to the midclavicular line, that could be a sign of cardiomegaly. So we want to take note of that, of the proximal impulses more lateral, that's cardiomegaly. The other things that we're going to palpate is heaves and lifts. So for heaves and lifts, we want to put our hand over the intercostal space, and a heave is basic, and lift is basically a sustained impulse that rhythmically lifts the fingertips, and that can be an indication of enlarged atria or ventricle or just chamber. The next thing we're going to do is a thrill. So we're going to place the ball of our hand, or the base of our hand right here onto the chest, and that basically is a buzzing sensation caused by underlying turbulent flow, and that could also be indicative of valvular stenosis or valvular regurgitation. So once we have finished the palpation section, we will go into percussion, which basically is if we're unable to find any of these pulses with the tangential lighting, that will help indicate the proximal impulse of the heart, and that will help indicate where that is and everything. Something I did not mention is that for the palpations and stuff, we want to make sure that females are able to shield their breast in the case if we're working on a female. The next thing that we are going to check is for auscultation. So with auscultation, there's 6 listening spots that we want to look out for. I'm going to go ahead and we can use diaphragm and the bell. So the diaphragm is used for high-pitched sounds S1, S2, and the bell is used for low-pitched sounds S3, S4. So we're going to do both of those for all 6 listening spots. The first listening spot is going to be the aortic valve, which is going to be found right to the sternum in the second intercostal space. Then we're going to then the second one is going to be the precordium valve, which is going to find left to the sternum in the second intercostal space. Then we have Erb's point, which is going to be left to the sternum. In the third intercostal space, then we have the fourth, which is the tricuspid valve, which is going to be left to the sternum in the fourth intercostal space, and then we have the mitral valve, which is going to be left to the sternum in the fifth intercostal space. Something to also mention before I even perform this exam is that I want to make sure that the patient is breathing normally, and once again, that if it's a female, they are shielding their breast. After I have done both the diaphragm and bell for all the 6 listening spots, while we're doing this, I also want to check for the carotid artery, which will be used with both the diaphragm and the bell. And I will be looking also for carotid obstruct, which basically identifies systole and diastole, S1, S2. And something to also note with that, before the carotid obstruct, that's S1, and then S2 generally follows the carotid obstruct. Some abnormal sounds with the heart are S3, S4. So S3 can be indicative of congestive heart failure, and S4 can be indicative of hypertension / aortic stenosis or something like that. Thank you for joining me on my heart exam.